Health News is brought to you by Dynamic Physical Therapy. Call us today to set up a free 15-minute screening with a physical therapist.
A large number of jobs require people to sit for extended periods of time, and those occupations can cause unexpected health problems. As the workplace has changed, the cases of back and neck problems have also increased.
Very common. This is probably one of the more common conditions that we will generally see in the working generation, particularly clerical occupations, white collar occupations. Typically occupations where people are seated more. So it has become much more prevalent over the last 10 to 15 years as internet technology has increased, as the ability of people to do work from home on computers has increased. Just overall in general, people having more time to spend in front of a computer. So we're seeing these much more frequently.
Aaron Mazza is a therapist with Dynamic Physical Therapy. He says that almost any job that involves sitting at a desk or workstation can cause issues, but computer workers are particularly at risk.
Seated occupations can range from anything from an engineer to anybody that spends any amount of time in front of a computer, and this day and age it's almost anybody and everybody. We do everything behind computers now. If we're not behind computers at work, we're behind them at home. Students are behind them all day. College students, we're seeing more and more problems with younger generations presenting with symptoms that we would otherwise see years ago in older generations, simply because of the seated posturing that we're seeing more common now behind computers.
Luckily, there are a few basic things that people can do to reduce the chances of back and neck injuries.
The simplest thing somebody can do in that situation is to roll a hooded sweatshirt up or maintain some kind of a cushion bolster and place it right behind the small of their back, because what that does is that brings the shoulders back over the pelvis and creates less forward posturing, which eventually cascades into neck pain, upper neck pain, shoulder pain. If we keep the center of gravity back behind the pelvis, the shoulders henceforth fall into place, and we have less of the chronically occurring problems of the shoulder and the neck.
If those basic solutions do not fix the problem, physical therapists can work with individuals to find the cause of pain and make sure that it is dealt with properly.
Generally, what we're going to do is we're going to do a little bit of a subjective review of that particular patient's ergonomic setting at work. We will do a postural assessment. We'll palpate tissues that might be affected that will result that we might feel some trigger pointing, some nodding. We'll palpate and assess scapular positioning. And we'll palpate and assess how they look, what their seated attitude is like in a seated position. We'll also assess, other things that might result, cervical radiculopathy, things of that nature. So we'll do a quick neck screen. And we'll also do a lot of times a general upper extremity function screen, just to screen out any kind of weaknesses or imbalances that may result further contributing to the problem. So.
And eliminating neck and back problems early is important, because pain and injuries can become significantly worse over time.
The biggest chronically reoccurring problem that we see down the road resulting from postural deficiency is usually cervical radiculopathy. Among other things, are rotator cuff problems in the shoulder due to forward positioning causing more friction inside the shoulder because the shoulder not having enough space to move, resulting further in joint spurs that will cause rotator cuff tears. Between that and cervical radiculopathy, those are the two primary causes, or the two primary things that we'll see chronically occurring from chronically forward posturing resulting from seated occupations behind computers.
For My News 26, I'm Kayla Kiley.